We are live, sir.
Right. So, a very good evening to all of you. And this side, Dr. Saurabh Bhatia, pharmacology mentor at DBMCI. And today we have a very special event because we have a privilege that Dr. Gowri is with us, and she has secured rank 384 in this NEET MDS 2024 exam. So, big congratulations to Dr. Gowri.
Thank you, sir.
Yeah, so like it's just kind of a feeling like I can imagine this feeling. This is out of the in this world, right? So how are you feeling
Yes,
right
sir.
now?
So I am feeling so happy. My family also feeling so happy. First of all, I want to say gratitude to all those who support me to achieve this, especially my family, God, and also the members of TBMC who are the pillars, the entire team. I want to thank each and everyone of the entire DBMC family.
Right, right. So Gauri, like like what you have achieved is like really achieved by someone. There's so many dentists appear for this NEET exam, and you are the one who have got this very good rank. So really, really a great thing. So Gauri, like we are right now on the YouTube. So would you like to share your journey of the preparation? Like how did you prepare for this exam, and what are the various factors you have considered while preparing for the exam?
Okay, so well, sir, I started my journey preparing from the April 2023.
Okay.
My first revision started along with my the live classes. I allotted 1 or 1.5 weeks for each subject, and I completed within the live period only, that live class time only. And I attempted PCT and also subject wise test simultaneously. And my second round of revision started. I have done it with along with the T and D, which was very useful. The questions were discussed in the evening after the test. It was so helpful that the not only the specific questions along with all other topics, surrounding topics were also be discussed. And my third revision was done along with the revision pro videos. Along with these revisions, I started doing PYQs, or I
Okay.
started revising the GTs like thrice in a week or like. And I attempted all the Q banks in the eGurukul app, all the test subject wise PCT and the mini mocks GTs, and I tried to complete reviewing the answer same day itself.
Okay. So like what I have got to know, you have revised around 4 times for the whole syllabus, right?
Yes,
And
sir.
4 times you have
Completely, I
revised it.
revised 3 times, and
Three
some
times. Okay.
subject yeah, the tougher subject I got time to revise only 4 times.
Okay. 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 So like as you were our student, so I can see like you have prepared, you have worked so much, so hard for this exam. So how much contribution is of DBMC in this journey?
Sir,
Because
it's
like you're saying, you have attended our PCT also, as well as the
yes, sir.
PYQs, as well as the question bank and revision pro videos also. So like how much contribution you want to give to the DBMCA?
Sir, they only gave me the path to walk through. They only supported. They only actually I was not aware of how to prepare and all.
Mhm.
Himani ma'am only gave me the schedule, and
Mhm.
all the mentors were throughout helping out. In case of doubt section also in the Telegram group was so active. The doubts
Mhm.
were solved within 2 days, 1 or 2 days, or sometimes even on the spot itself, and it helped me a lot.
Okay. So, and regarding this question bank, so how would you like to grade our question bank? Like, did you find the questions which are same as asked in the exam, or I mean, what kind of pattern you find in this question bank?
Yes, sir, it's what almost same. And I got used to the questions while
Mhm.
solving. I got used to the questions, and the analyze that we get at the end. It gave
Mhm.
me a idea where I am standing and also where I lack, where I need to put more effort. It gives an analyze that rank was given. Also, the weaker areas were also given.
And after attending this live lectures in DBMCA, so when you go back and start doing the questions, so how many questions you were able to solve out of like 10? So how much
I was
percentage?
able. to solve 75 to 80 percentage of questions.
Okay, it means these notes are also very useful for you, like the
Yeah, sir, the
answers.
notes were so crisp and clear.
Mhm,
It was so useful. I used to write during the live class, and I
mhm.
reversed the handwritten notes only, sir.
Okay, like many students are listening to us right now. So while you're preparing for the this exams, so I can understand like students have to gone through this ups and downs during the preparations. So you must have also felt this phase like when you were not motivated enough to for the studying and you were not able to study for at least 2 or 3 days. Then which
Yes.
kept you motivated all the time, and how did you motivate yourself so that you could come back to the journey of this preparation?
So whenever sometimes some GT scores were slow, that time I used to message to Himani ma'am. She said, just keep on studying. Don't bother the rank now.
Mhm.
She was giving support like that, and what to say, more of I self motivated, sir.
Okay, in self-motivation, what did you think? Like today, like if I'm not feeling like studying, so how do you keep yourself motivated? What exactly
So
thought
when
is there in your mind so that you will come back to the track?
so whenever I got saturated, I just take some breaks in between.
Hmm.
Usually, in a week, 1 or half a day break was taken. That makes me more tense when I came back to study. So I will study for after that. So breaks were break. I used to take breaks.
Okay. And Dr. Gauri, like many of your juniors who may be listening this video right now, so like these days I have seen the students who have done this BDS are not very entho in doing this MDS also. They don't prepare for this MDS exam. So what do you suggest them? Like is like they think that it's not possible to achieve this success. It's not possible to get this MDS seat in a government college. So do you like you have just now cleared? Can you guide them? Can you give them some guidance so that they will not feel so much demotivated and they should prepare for this exam?
Sir, there is nothing like it cannot be done, but it requires a continuous, regular study, sir.
Okay.
First of all, we should go theory as we should study theory as well as we should do as much as PYQs and questions. Only then we will be used to do questions at that time. So, by regular studies, we can achieve that.
And Dr. Gauri, how was the question paper this time, the exam which you have given?
Sir, it was too
Because
tough
I have
for
heard that
me.
students are saying that it's totally clinical. They are not asking the one-liners, right?
Yes, sir, it was too tough.
This was
I
tough.
did, yes, sir.
And was it more of clinical side, clinical based questions, or is the one-liners? Like students have gave me this feedback that's more or less clinical questions. Like if I talk about the pharmacology, so all medical emergencies scenarios they have given, and they asked like how to manage this medical emergencies when the patient is in dental chair. So is it so? What about the other
Sir, it,
subjects?
it was mainly clinical questions, but a bit tricky. It was not the direct one-liners. It
Okay.
was sometime somewhere it is twisted, and we have to think more.
Right, right. So, like students who are listening, for them, like Dr. Gauri has started in 2023. So, I think 1 year preparation is enough to crack this exam. And I think the keeping the momentum is very important. Like she has
Yes,
prepared for
sir.
she has revised the syllabus for 3 or 4 times. So, keeping the momentum, keeping the schedule ready with you, keeps on motivating yourself so that you will not get diverted from your studies. These are the main crux of this preparation, right? So, Dr.
Yes,
Gauri,
sir.
what's your next plan? But which seat you're planning to take? Like, what's your dream branch?
So I like console, console surgery. My first preference is console surgery.
Okay.
Then I like pedo.
Pedo also. Okay, that's really nice. So thanks, Dr. Gauri. Thanks for giving us the time. And it's like again a lot of congratulations to you and your family. And it's we as a mentor feeling really proud of you that you have cleared this exam. So it's not about your success; it's also our success. So we have helped you out in this journey. Thanks, Dr. Gauri. Thanks for giving us time.
Thank you, sir. Thank you, sir.
Enjoy your life.
Thank you, sir.
Right. Take care.
So
Bye.
thank you, sir.